Hello, I'm Jonathan Earnshaw, Editor-in-Chief of BJS British Journal of Surgery. I'm here to introduce you to the October edition of the journal. This month is a bumper issue focusing on the treatment of pancreas cancer. There are 5 articles on this condition, including 2 discussing the role of extended surgery and the first formal comparison of laparoscopic and open pancreatectomy. Professor Keith Roberts summarises the state of knowledge in his leader and also talks about the issues in a podcast to go with this journal. I'm not going to mention the pancreas again, except to encourage you to listen to the podcast. Also on the podcast is Professor Steve Wexner, celebrated colorectal surgeon from Florida. He's there to talk about the value of social media in promoting surgical research. He and co-authors have described the use of the hashtag colorectal surgery to gather anyone interested in the topic together. It's a pleasure to welcome the first author of the paper, Richard Brady, to the BJS editorial team as our social media lead. Richard will teach us how to maximise the value of social media in improving the penetration of BJS research. Who knows, you may even have received this podcast on one of his tweets. Richard is already using the power of social media to catalyse and unite surgeons. BJS wants to build a vibrant and growing community interested in surgical science. We're going to use a new hashtag, surgical research, to promote a global surgical research conversation. Please join us if you can. Moving away from the pancreas and social media, there's lots to enjoy in the rest of the October BJS. There are 2 strong randomised trials, one testing the potential benefit of a score-based system to reduce the need for CT in patients with appendicitis. The second looks at the value of laparoscopic ultrasound imaging before colorectal resection. John Gollidge from Queensland, Australia, makes the case for a trial of metformin, the diabetes medication, to reduce growth rates of abdominal aortic aneurysms. Using a number of different data sets, John and colleagues have shown a consistent reduction in growth rates in those on metformin that does not occur in diabetics on other medications, suggesting the effect is independent of diabetes itself. An RCT seems warranted. Ductal carcinoma in situ of the breast is considered a non-lethal diagnosis. But Wadston and colleagues from Sweden analysed over 6,000 women with the condition and found that size over 25 mm or multifocal DCIS was associated with a small risk of death from breast cancer. The authors argue this is a reason for clearing the disease properly at initial surgery. Finally, can I highlight a vignette produced by BJS statistical editors Jonathan Cook and Eunice Ranstom on non-inferiority and equivalence trials. Their short statistical vignettes have proved popular and a new series has been commissioned. We'll probably join them into a single PDF eventually that should provide guidance through the maze of surgical statistics. So now we come to the paper of the month. I'm going to sidestep the pancreas and award it to Anderson and colleagues from Sweden. Their scoring system to reduce the need for CT imaging in appendicitis seems to have the greatest potential to change surgical practice. That's all for this month. The editors are hard at work collating submissions for the special issue of BJS to be published early next year on cancer surgery in the genomic era. We've received an excellent group of articles, and the special issue promises to be one of our best ever. Thank you for listening. And remember to try the BJS hashtag, surgical research.